This video is about esophageal atresia and tracheo-esophageal fistula. It has been produced by TOFs, a UK charity supporting those born unable to swallow. This presentation will be particularly suitable for parents who have recently learnt that their baby has one or both of these conditions. If you are in this situation, you might like to visit our website, tofs.org.uk, or purchase a copy of our book, The TOF Book, which is available on amazon.co.uk for delivery worldwide. You are likely to be thinking about esophageal atresia, or OA, and tracheo-esophageal fistula, or TOF, a lot at the moment. It may be useful to know that, because of spelling differences, these conditions will be referred to as EA and TEF in the USA. During this video, we will use the term TOF for convenience. This abbreviation is commonly used whether just one or both of OA and TOF are present. TOF is sometimes suspected before a baby is born, from prenatal ultrasound scans, but a diagnosis can only be made for certain after delivery. It affects around 1 in every 3,500 babies. If you are worried about possible causes, please be reassured that very few cases are associated with genetic defects. In the vast majority of instances, the cause is not known. It may help to realise that you did nothing wrong and it is not your fault. So, what is OA TOF? We'll explain shortly. For now, let's just slow things down a bit. You've had quite a shock with this news, and it's really easy to get overwhelmed by it all. Self-care is important. We recommend that you look after yourself during this difficult time. Seek support. Take frequent breaks from the intensity of the hospital environment. Eat and drink properly and sleep, or at least rest if you can't sleep, adequately. It can be very difficult to take in information when you are stressed. Don't be afraid to ask questions, even if you end up asking the same ones time and time again. Many people find it a good idea to write queries down as a list, so that you have something to prompt you when the appropriate medical or surgical personnel are present. And lastly, do enjoy your baby. Your presence, and in particular your touch, will help him or her. You may find that being around your baby is somehow calming for you too. Let's look more at OA and TOF. A normal child has a food tube, the esophagus, that connects the mouth to the stomach, and an airway tube, the trachea, that goes to the lungs. In esophageal atresia, the esophagus is incomplete. There are 2 separate ends with a gap between, so food in the mouth cannot go to the stomach. This gap needs to be joined up to allow the baby to feed. In tracheo-esophageal fistula, there is a connection between the food tube and the airway. This means that swallowed fluids can enter the respiratory tract. The abnormal connection needs to be closed off. These 2 conditions usually occur together, esophageal atresia with tracheo-esophageal fistula. Most babies with OA TOF are operated on within a few days of birth, but sometimes the gap between the 2 ends of the esophagus is too great to join straight away. Surgery always takes place in a specialist paediatric surgical unit, and your baby will be in hospital for at least a week. TOF without OA is less likely to be picked up after birth and may go some considerable time before diagnosis. Once surgery has been carried out, what does it mean for your child as they grow up? Well, every child is different. Different children may undergo different types of repair. Some may be born with other problems, such as heart or kidney problems, and the nature and severity of ongoing issues will vary. It will be necessary to maintain follow-up appointments with your paediatric surgeon and the rest of the specialist team at the hospital. In time, you may get to know the staff quite well. Common challenges include feeding difficulties, narrowing of the food tube at the site of the join, known as a stricture, reflux, which is when stomach contents flow back up into the esophagus, causing irritation, and respiratory problems, which include the consequences of a floppy trachea, known as tracheomalacia, and frequent respiratory infections. These problems are often interrelated. For example, a narrowing is likely to be associated with feeding difficulties, and reflux can contribute to feeding difficulties and to a narrowing and to respiratory problems. While all this may be concerning to hear about, remember that the difficulties encountered by each child will be different. The good news is that problems get less with time. As your child grows from baby to toddler to child, teenager, and then adult, some issues disappear, and he or she will learn to cope with any restrictions. Adult TOFs can mostly eat what they want and participate in a full and active life, although it is recommended that lifelong follow-up is maintained. Remember, the charity TOFs will always be there for you. TOFs can provide you with more detailed information about OA and TOF, as well as putting you in touch with other families who have experience with these conditions. To find out more about what we do, please visit tofs.org.uk.